Good morning. This is Jessica, the audience. Beautiful. Camera guy.
Nurses not only save lives, they educate. As a nursing student, I've been taught that there's always a need for patient teaching. I'm going to talk to you a little bit about patient education, the role the nurse plays in teaching and learning, and culturally appropriate teaching. The purpose of patient education is to promote and maintain health and prevent illness. In order to do this, the nurse provides information and skills to promote healthy behaviors. The greater the knowledge the patient has, the better health is promoted. The patients become more health conscious and will seek early diagnosis and treatment. In order to restore health, the nurse will identify the patient's willingness to learn. If the patient is not motivated to learn, then teaching cannot occur. Family is very vital because they provide support and encouragement. In order to do this, the nurse needs to assess patient and family relationship and determine whether the patient wants the family involved in their plan of care. The patient will be coping with impaired function. It's the nurse's job to provide information and skills to help preserve the quality of the patient's life. They may teach about modifiable factors such as diet and exercise or smoking cessation. So what roles does the nurse play in patient education? Well, nurses are patient advocates. Patients have rights, and they have the right to obtain as much information as they can about their medical condition or about any procedures they're going to be undergoing or treatments and medications. It allows them to make informed decisions about health. Also, the nurse clarifies any information about For example, medications. It's the nurse's duty to provide what type of medication they'll be giving, their side effects, when to call the healthcare provider. The nurse will identify the need for teaching, and by doing this, the nurse will build a good rapport with the patient. They will ask the patient questions, see what they know about their diagnosis and treatment. And once this is done, they will the nurse will use simple words or visual cues to demonstrate to the patient, maybe a certain procedure or certain exercise. And also the nurse will ask the patient, for feedback to see if the teaching was effective. Lastly, I will review culturally appropriate patient teaching. There are many cultural beliefs and backgrounds, and the nurse doesn't want to stereotype. Instead, the nurse wants to provide culturally competent and culturally sensitive information. By doing this, the nurse will collaborate with other healthcare providers, such as other nurses or doctors and therapists, whoever's involved in the patient's plan of care. And they will come up with appropriate teaching approaches. Also, it's vital to ask the patient, what are your beliefs and values? So that way they can plan according to their beliefs. Language is very important because if the patient doesn't understand what the nurse is talking about, well, no teaching is going to happen, right? Family members are vital in this aspect because they can help translate. Even though in nursing school we're told you should always have an interpreter, sometimes that's not always feasible. So you have to utilize what you do have, to make sure that the information gets across to the patient. And the family members are more than likely going to be involved in the patient's plan of care anyway. Also, if that doesn't work, if nobody understands, the nurse will utilize what's called the language line. And this is where they call up an interpreter. However, according to an expert I interviewed, Lynn Swisher, an RN at Baylor Grapevine, she stated that it's not really helpful just because they do relay the medical terminology to the patient, but some things get lost in translation. And I'm told it's also not very cost effective. It's expensive. It's expensive to the patient, and sometimes it takes a while to find an interpreter. So I have shared with you one of many aspects of a nurse's duties. There is always a need for patient teaching, and it's an ongoing process. And I'd like to leave with you this quote by an RN named Lois Capps, who said, "Nurses serve their patients in the most important capacities. We know that they serve as our first lines of communication when something goes wrong or when we are concerned about health."
Back to the audience.